Now, if you're eligible for Medicare, did you know that there are local provider offices designed specifically for Medicare patients that can help you with your specific health care needs? My special guest today is Dr. Mickey Crane, Practice Medical Director at Iora Primary Care in Tucson. Also with her is Stephen Smith, Tucson Sales Manager for Humana. Thank you guys both so much for being here.
Thank you.
Doctor, let's kind of just jump right into it. I'm kind of letting everybody know off the top about these local offices that are very specifically designed for Medicare patients. If I'm a patient, what benefit do I get going to one of these places?
Sure. Our aging adults actually have unique healthcare needs, and so it's important for them to be able to get the higher level of attention with their primary care team. And that's to help address any concerns that they might have, changing healthcare goals, and changing needs also for their specific health problems they might be having. So at Iora Primary Care, our team approach to healthcare is based on relationships with our patients. We listen to them, we talk to them, we get to know who they are, who their caregivers are, who their loved ones are. And so with that, we're able to learn about their health. We're able to help them coordinate their care with their caregivers, specialists that they might need, and any type of health insurance plans. And so we're all on the same page to be able to do that. And to assist that, we actually assign a health coach to each patient coming in the door, and they help them navigate their care through the healthcare system there. When you walk into one of our clinics, you'll see how we designed it to be welcoming for seniors. The reception area is open, it's inviting. You don't have to stand in line to check in. Our hallways are wider to allow for those that might need to use a wheelchair to get around. When you get into our exam rooms, we all sit around a round table, and that's the healthcare team, the patient, and their caregivers. And what we do is we sit and we discuss that person's particular plan so we all understand what's going on. We have labs on site at both our clinics. We have a group room where we're able to hold classes and to hold other events. And then we have plenty of parking that's at the ground level, so they don't have to take any steps to get up into our clinic.
All of that sounds like what's going to make us more comfortable, make us our mind at ease, things that we can feel like we're really being heard, which is a huge advantage for what we're looking for when we want to go to somebody with problems that we're talking about. On top of that, what do you really do to make sure that your patients are healthier?
Right, so we're able to take the time with the patients and come up with an individualized healthcare plan for them. And that's to help them address any healthcare goals they might have, any questions they might have as well. We want to keep our patients out of the emergency room. We want to be able to avoid any unnecessary hospitalizations, and so prevention and follow-up care is very important for us. And we take an integrative approach as well. So it's not just the physical aspects of their care, but we're also taking into account their emotional, their mental, as well as their social aspects of their health and what's going on in their life. So Iora offers free classes and events such as exercise classes. We've had some educational talks on health topics, and the social events, we've done things like bingo and a movie night as well too. So you know, our vision at Iora is to transform healthcare for seniors, so we invite any eligible Medicare adults age 65 and older to come by one of our 2 Tucson locations and see for themselves what we can do for them.
You know, what I'm really hearing from you right now is just well-rounded. That's what I'm kind of hearing, everything in a nice umbrella, is that you're really not just taking care of one thing. You're trying to take care of really the person, everything that they might need. And I really think that this is something that a lot of people are going to want to take advantage of. But Stephen, how do we take advantage of that? How do we get the beneficiaries access to something that really would benefit them very much?
Well, what beneficiaries need to do is they need to research these value-based providers, make sure that these providers are in the network for the programs that they're looking to join. With Medicare Advantage plans, you want to always check the providers in the networks, and value-based providers are an integral part of our network as well. So Humana does have these folks in the networks. They want to make sure that they are able to research and make the right decision based on who's in the network. The value-based providers in our network is at no more of a cost or expense than the regular providers in our network. And the preventive screenings, again, very important.
I know we've talked about that and preventative measures that are going to be taken, but I'm going to remind everybody how they can get a hold of both of you guys if they have more questions or want to make a visit like you were suggesting, Doctor. But thank you both so much for coming here, letting us know what is available out there. This is a great time to talk about this.
It is.
Now, to learn even more about this information, you can call 1-800-552-0771 or point your web browser to humana.com/transforming health to contact Iora. Log on to ioraprimarycare.com.